Well, I'll start by introducing myself. My name is
Okay.
Mohamed, and I'm 17 years old, high school student from Morocco, and I'm also a COVID-19 fellow for MP Global Youth. Today I'm here with Dr. Josh, and we will be talking about COVID-19 and the impact that it has on young people and the public health sector. Can you please introduce yourself, Dr. Josh?
Sure. My name is Josh Sharfstein. I am a pediatrician and I work at the School of Public Health at Johns Hopkins. I previously have worked in different public health jobs in the city of Baltimore, in the state of Maryland, and at the US Food and Drug Administration.
Thank you for it is our honor for us to having you with us today.
Well, it's my pleasure to be here.
Thank you. For our first question, how has COVID-19 impacted your work at Johns Hopkins?
So it's interesting. I work at a school of public health. It's the oldest school of public health in the world. And it started during the influenza pandemic. That was in 1918 and 1919. And that was when the school started, right around then. And so here we are 100 years later, and we have another pandemic. That first pandemic, there were a lot of people who had to, stop what they were doing and work on influenza. And now there are a lot of people, not just at our School of Public Health, but at Johns Hopkins University, who have stopped what they're doing and they're just working on coronavirus. So people may be familiar with the coronavirus map, which you can go to and see all the cases around the world. That's at Johns Hopkins. That was created by a engineering professor. And then there's also a lot of people doing work analyzing data about testing and cases and hospitalizations and deaths. We have people who are thinking about the policies that need to be put into place to reduce the coronavirus spread. We have people who research the basic science of the coronavirus. So the coronavirus is growing in some of the labs. There are people who work on treatments and are doing clinical trials to find new vaccines and new treatments to save lives. So there's so many people at Johns Hopkins right now who have, changed what they're doing because the moment demands it. For me, I've been doing a podcast called Public Health on Call. We have 3 million downloads, and we've been talking about a lot about coronavirus. I advise different mayors and governors about how to respond to the coronavirus pandemic. I write about different aspects of the coronavirus, and I teach students about the coronavirus response.
And where can we find this podcast you were talking about?
So you can find it anywhere you get podcasts. It's called Public Health on Call. And I hope you like it. We have a lot of good episodes, and you can write in with ideas for other episodes.
Thank you. For our next question, how has COVID-19 changed the public health sector more generally?
So the public, COVID-19 has really demanded the attention of the public health sector. It's a little too soon to say how much it's changed it. Now, I hope that what happens is that people realize how important public health is, and over time, people invest more in public health. Public health is about prevention. It's about keeping people healthy and working together to keep people healthy, and particularly focusing on the needs of marginalized individuals and communities of color, for example, that often are ignored by policies. It's to help people stay healthy, everyone in a society. And unfortunately, public health efforts are often underfunded. Typically, in the United States, for every dollar that's spent on health, 97 cents goes to health care and only 3 cents goes to public health to keep people healthy. Now, in other countries, that is probably not quite as unbalanced, but still, even in Morocco and in other countries, I think we could use more of an investment in public health so that we are spending money to keep people healthy and to be able to live the lives they want, rather than just pay for people after they get sick to help them get better.
Yes, and have you noticed a change in the funding that is for the public health sector after the pandemic happened or not?
Um, I have noticed that the public health sector is working very hard. The public health sector has had to do many new things. We've had to organize testing. We've had to do contact tracing at a scale that is far exceeds what has happened before. We have to learn quite a lot about a virus very quickly and give advice about masks and other types of things. So it has been a lot of change for the public health sector.
Thank you. For our next question, what have been the biggest successes and failures during this pandemic?
Well, I think some of the successes are scientific. We learned what virus was behind this very quickly. We've learned a lot about the virus. We know how it spreads. We have also very quickly developed some medications that work for the virus. And we've also put the vaccines on a very rapid path to development. So I think those are all very good things. I'm very excited about the possibility of getting a vaccine that will protect people from COVID. In certain parts of the world, the public health response has been extraordinary and has really shut down the infections. And so you can look at countries like South Korea, Singapore, Taiwan, where there's hardly any transmission, and New Zealand, large parts of Australia, that have done just a tremendous job in reducing the number of cases of the coronavirus. And so I think that that work has been great. Even in places with a lot of cases, there is really heroic work being done by doctors and nurses who are saving patients' lives, who are putting themselves at risk to save patients' lives. By public health officials who, even when the number of cases is high, are doing everything they can to slow down the spread, taking sometimes unpopular actions, but things that really have saved lives. That's certainly, I think, important. Not every action is the right idea, but there are certain things that have really made a difference. And then I also think that in addition to those types of successes, there have been failures. I think some of the failures have been, for example, in the United States, that the response has been unfortunately politicized, meaning that some people think that whether you wear a mask or not is whether you're a Democrat or a Republican. And really wearing a mask is just about humans versus the virus, not Democrats versus Republicans. And so I think a failure has been, in some places, people seeing the response as political instead of as a public health response.
Yes, I understand. For our next question, do you think COVID-19 has equipped us to handle a crisis like COVID-19 better in the future?
That's a good question. I would say COVID-19 is a crisis. We are in the middle of dealing with it. I think we will probably learn some lessons from this crisis to help us with the future, but which ones we learn, it is not clear to me yet. I hope that we learn the lesson that we need a strong public health sector in order to support prevention, even when there's no pandemic. We can prevent people dying from heart disease. We can prevent people dying from lung disease. We can prevent drug overdoses. There's a lot that we can prevent if public health is supported. I hope that is one lesson. I also hope there's a lesson that we need to be really prepared for pandemics, because this is not the last pandemic. This is a huge pandemic. It may not be the biggest one in your lifetime. There may be more. And so we have to learn the lesson that we need to be prepared. We have to be ready with masks. We shouldn't run out of masks. Everyone should have access. There should be support for people who can't go to work. There should be policies that we can trigger and messages that we can use as we learn about whatever the cause of new pandemics might be.
Yes, the best strategy we can follow is hope for the best and prepare for the worst.
Yes, we've been hoping for the best, but we haven't been preparing for the worst very much.
Yes. And is there anything that is making you feel hopeful about the future right now?
The vaccine is making me hopeful about the future a little bit, because we're hearing some very good news that we could have a vaccine. So I think that as difficult as it is in some parts of the world right now, we have to realize that it's just a matter of time, I think, before maybe we'll have a vaccine that can really help us. That's making me feel hopeful. I'm always just so impressed and inspired by people who work so hard in public health and in medicine to care for patients, to protect, um, their fellow citizens, even sometimes at risk to themselves. So that gives me hope that even at moments where it's easy to despair, you can really see that there are people who are out there fighting for their communities to be healthy.
Yes. For our next question, what impact do you think COVID-19 has had on young people, especially?
I'm going to ask you that question. What question do you think COVID-19 has had on young people? What's your opinion?
I can only speak for myself. I believe COVID-19 had his positive impacts and for sure like negative impacts. And for me personally, it had more positive impact than the negative one. So I cannot speak.
Interesting. I think COVID-19 has been very hard for a lot of young people. They often can't see their friends. Young people love to see their friends. That's what young people do. And if you can't see a lot of your friends because of the risks, then it is difficult. And as a result, there's a lot of anxiety. There's a lot of depression. And so I think that the main overall impact has been a lot of stress for young people in many parts of the world, not everywhere. And of course, some young people have gotten sick, and some young people have died. So it's a pretty serious illness. Tell me, what are the positive aspects for you?
For me personally, COVID-19 had given me the chance to participate in a lot of virtual exchange programs. So I
Mm.
mean, I live in Morocco. I'm a high school Moroccan student. I didn't have the chance to exchange ideas and informations with the foreign students, and I only had this opportunity because of COVID-19, I guess.
Well, that's very interesting. And I think that we have learned a lot about how to use technology, in many different ways to bring people together. And I'm glad to hear that you've had a chance to use technology through COVID, and meet a lot of other great young people around the world.
Thank you. For our next question, do you have any advice for people to take care of themselves and cope during crisis and lockdowns?
So, there are ways to take care of yourself from getting COVID. You should be wearing a mask when you're around, people outside your home. And even if people are inside your home have been exposed to COVID, you should wear a mask. And wash your hands, keep your distance. It's really important not to go to big parties indoors. The virus loves being indoors. And anywhere that you're indoors where people are not wearing masks, you have to think that the virus is happy. And if the virus is happy, then we should be concerned. So I think it's very important to protect yourself from the virus. Now, you might think, well, I'm a young person. I don't think I'm going to get that sick, because most young people do not get that sick, but you could pass it on to your parents or grandparents or to your neighbors or to someone else that could get very sick, even if you don't. But the other thing is young people can get pretty sick. And there are definitely young people who, may pick it up from their friends who aren't too worried about it, who get very sick. So I think it's very important to take the coronavirus as seriously as possible. To me, that's important. Now, how do you protect yourself from anxiety and depression? I think they do the things that you're talking about. It's really important to keep connected to your friends, even if you can't see them as much as you ordinarily would, or you can't be so close to them. You have to sit outside wearing a mask or something, And so video conferences, one of my sons is your age, and he does Dungeons and Dragons. Dungeons and Dragons? Do you know that game?
Not sure. Is that a game?
It's a game where you can play over the phone, or through video. And so you go on a quest with your friends. And so he has regular games that he plays with his friends, And so I think it's important to stay connected and also to look out for people in your world who you're worried about. Like if you have a friend who's very quiet, what's wrong? Ask them what's wrong, and go out of your way to help them, because sometimes people have a hard time explaining if they're sad or they're lonely, and it's really a good friend who can be there for them. And then if you're really worried about someone, some people really do need help and they can get better. People who are very depressed, there's very good treatment for people for depression, and people feel a lot better. So if you're really worried about somebody, it's important to help them get help. Talk to an adult, or somebody who can connect them to services, or talk to a doctor or something like that, to help them. So I think it's about staying away from COVID, but staying connected with your friends, even if you're not that close physically.
Yeah, I believe a lot of young people have been expressing their thoughts in a very unhealthy way because of lockdowns, because they couldn't express their thoughts to their friends and most precious persons, and they couldn't share this kind of information with their family. I believe that's the problem.
Yeah, it's important. And I'm sure your parents are scared, really. I mean, it's natural right now to be scared. And I think it's hard sometimes for parents to talk to kids about times when the parents are scared. Parents are supposed to be ready for anything. Parents are supposed to be showing strength to their children and not showing that they're scared. But this is a moment where parents can be very worried. Parents may be worried about the grandparents. They're worried about their kids. They may be worried about their jobs. So it's a very stressful time. And, it's easy for parents to, have a hard time with their kids. It's easy for their kids to have a hard time with the parents, And so this is a moment where it's really important to be good to each other and to be nice, and to keep the door open to people to be able to talk.
Yeah, I think it's the best time to care and show how much you care about someone and show them that you love them, because these are the hard times where people need to express their thoughts and feelings.
Very
And
true.
yes, I also have a question. For me personally, I believe this virus is very dangerous because how easily it can be transmitted. What about you? What do you think about that?
Yes, I think that is one reason why it's very dangerous. It's very easy to transmit. And if you're very close to someone, particularly indoors and particularly without masks, it is very, very easy to transmit. And there are other ways it can be transmitted too. So washing your hands, keeping distance, wearing a mask, very, very important.
Yeah, and what are the other ways this virus can be transmitted, you said?
So the most common way is through breathing the air that somebody who is infected has breathed out. So some people call that swapping air. So if you're swapping air with someone, then that's one way the virus can be transmitted. That's probably the most common way. It is also, in theory, possible if the virus lands on something and you touch it and you touch your eyes or your nose, that the virus can jump in to you. That's called fomite spread. It's probably rare, more rare than the air spread. But those are the two biggest ways.
Thank you. For our next question, where can teenagers and people in general learn more about global health and the public health sector?
Good question. So there are a lot of places to learn about global health. The World Health Organization has some great information online. There are some great foundations that work on global health. There are schools of public health like ours. If you go to the Johns Hopkins Bloomberg School of Public Health website, you can read all about a whole bunch of different global health projects that we have around the country, and around the globe. There are foundations like the Wellcome Trust or the Bill and Melinda Gates Foundation. So I think that there's a lot of information. Now, of course, global health is a big topic. So you may ask yourself, what part of global health am I most interested in? Am I interested in vaccines? Am I interested in COVID-19? Am I interested in heart disease or how the tobacco industry works? All those are good questions. And if you start searching for those, you'll find a lot of information on almost all those projects. We have faculty at Johns Hopkins working on them, but also there are many, many great people around the world.
Yes. Would you like, do you have any advice you would like to give to people who are willing to pursue their higher education in public health?
I think it's a wonderful field. You know, in public health, you wake up every morning and you think, how can I make people healthier? Even if they may never thank me. You know, there was a great health commissioner in Baltimore City, a great health commissioner, Dr. Lena Wen, and she would say, public health saved your life today, but you don't even know it. You know, in public health, it's not like a doctor who does the surgery. Public health is more like the person who helps you, and you don't even know. But it's very rewarding because you can look around and you can see children playing and people walking around, and you realize that you've made it happen. You've helped people live the life that they want to live and be happy. It's a great feeling, and that's why I think it's a great field.
Thank you. Do you have anything else you would like to tell our viewers?
Can I introduce your viewers to my dog who just woke up?
Yes, sure.
Hold on 1 second.
Take your time.
Here she is. She hurt her paw, so she has to wear this, you know.
Yeah, what's her name?
Her name is Luna.
Luna. Nice to meet you, Luna.
Yeah, Luna is a very good dog.
Yeah,
And
she's so cute.
she's very patient with me. She stays with me when I do work. She's my pandemic friend, you know, because
Yes.
I work in my basement and Luna keeps me company. Unfortunately, this is for medicine because she has a little infection on her paw, so she can't lick her paw. So we have to wear this, but she's a very good patient.
Yes, I can see her right now. She's not doing anything else about staying calm.
But I guess I would just say for finally that, you know, the moment that we're in now is very difficult for many people, but we will not be in this moment forever. You will tell your friends, your children, your friends' children, for years and years and years about your experience during this pandemic. We don't have much longer to go. I think over the next year, we'll start to see this virus recede, hopefully because of a vaccine. And I think the struggles that we have now are temporary. And so it's very difficult, but it's very important for everyone to do what they can to keep themselves safe, their families safe, to be good to their friends, to reach out to their friends they're worried about, to be good to their families, you know, to keep the door open to conversations with their parents and others. This is a moment because we're building a bridge to a different world, not only regaining what we lost, but hopefully to a better future. So I just hope everybody does keep that in mind. That's what I tell Luna, you know, you don't have to wear this forever. It's coming off, okay? You're gonna be back to yourself. That's sort of the same message for everybody too.
Thank you. Thank you for accepting our invitation to the live stream. It was an honor for us to have you with us today.